Welcome back to the Healthy Sleep Revolution podcast. I am Dr. Meghna Dasani, also known as the Sleep Dentist. And every week we explore the hidden connections between sleep, breathing, health, and quality of life. Because so many of the problems that we have learned to accept as normal, they're actually signs that something deeper is going on. Today we're going to be talking about something that seems incredibly simple: breathing through your mouth. Now, most people don't think twice about it. In fact, if I asked you whether mouth breathing was a problem, you might shrug and say, only if someone has a cold. But what if I told you that chronic mouth breathing in children can influence how their face grows, how well they sleep, how they behave in school, even how healthy they'll be decades from now? See, this isn't about scaring parents. This is about helping them recognize something that almost no one talks about until the damage has already been done. Let's dive in, shall we? See, breathing is more than just getting oxygen. One of the biggest misconceptions is that breathing is simply about getting more oxygen. It's much more sophisticated than that. Our bodies were designed to breathe through the nose. The nose filters allergens, bacteria, the little hair inside our nose, right? It the nose warms and humidifies the air. It produces nitric oxide. This helps to improve oxygen uptake, and it supports healthy blood vessels as well as immune function. So it does a lot more, right? It also provides resistance that slows the breathing, and it encourages our diaphragm to actually do its job. When you're breathing through your mouth, the mouth does none of these things. When breathing shifts from the nose to the mouth, especially when we're sleeping, it changes the mechanics of breathing, and it often signals that the airway is not functioning the way it should. Mouth breathing is usually not the problem. It is often the symptom. So then parents start to ask, why is my child breathing through their mouth? And there isn't one answer. I wish it were that easy. Sometimes it's allergies. Sometimes it's enlarged tonsils or adenoids. Sometimes it's chronic congestion. Sometimes it's a tongue tie or other oral restrictions. It could be narrow jaws. It could be a small airway. Sometimes the habit simply continues long after that original reason has resolved. The important question isn't, can they breathe through their mouth? The question is, why are they not breathing through their nose? Here's what is fascinating. Most children who mouth breathe don't look sick. They have little signs that by themselves don't seem important. Maybe they sleep with their mouth open. Maybe they snore occasionally. By the way, audible breathing in children is considered snoring. They do not have to snore the way you and I do. Maybe they drool all over their pillow. Maybe they toss and turn. They're restless sleepers. Maybe they're impossible to wake up in the morning. Ever meet a child who woke up on the wrong side of the bed? That's what I mean. Maybe they're constantly thirsty because their mouth is so dry, or they have dark circles under their eyes. There are some kids that are always congested. Maybe they grind their teeth, or they've been labeled as hyperactive or inattentive. See, none of these automatically mean that there is an airway problem. But put these together and they start to tell us a story that deserves attention, yours as well as mine. See, the face grows around the way we breathe. And this is one of the most incredible things I explain to parents. Our children's faces are still developing. Bones aren't fixed, they're growing. Breathing influences growth. When the mouth stays open, their tongue often drops out of its natural position, which is against the roof of the mouth, right? The roof of the Mouth is also the floor of the nose, and that's where the tongue belongs. Normal resting posture should be lips together, breathing through your nose, and tongue resting passively in the roof of the mouth. But when the mouth stays open, the tongue often drops from its natural position in the roof of the mouth. The tongue isn't just for speaking or swallowing, right? It is a natural growth guide. And without that gentle pressure from the tongue, the upper jaw doesn't quite develop to its full potential. It can become narrower. The palate may become higher. The lower jaw may rotate backwards. The airway can become narrower, smaller. Teeth become crowded. And what happens is many parents think that braces we're just simply correcting crooked teeth. Often, the crooked teeth are simply the visible evidence that there just was not enough room because the jaws didn't develop optimally. And the orthodontic problem, it just might be an airway issue. And sleep changes everything. This is where things become more important. When children don't breathe well at night, their sleep quality suffers. And children don't always respond to poor sleep the way you and I do. Adults, we become sleepy, tired, grumpy. Kids, they become busy often, hyperactive, impulsive, emotional. They find it hard to concentrate, be it in school or at home while they're doing homework. Many children who are being evaluated for behavioral concerns, I think they also deserve an evaluation of how they're sleeping and breathing. Again, it does not mean that the child has sleep apnea, but healthy breathing and healthy sleep, it deserves a seat at that table to be a part of that conversation. Here's why I care so deeply about this. That child that's sitting in your kitchen today becomes the adult who is sitting in my dental chair 20 years from now, or it could very well be my doctor. And adults with sleep apnea, they didn't just suddenly develop a small airway at the age of 35, right? It started way before then. It started with subtle breathing issues that nobody ever recognized. And that's why early identification matters. Not because we're trying to prevent braces. We are trying to help children develop healthier airways while they are still growing. Growth is opportunity. Adults require treatment. Children have the chance, the opportunity for early intervention. So what should I be watching for is the question I get from parents every day. If your child regularly has any of these signs, it's time to start asking questions. Do they have habitual mouth breathing? Are they snoring? Remember, audible breathing counts as snoring in children. Are they restless sleepers? Do we have behavioral concerns? Attention span issues at school? Chronic congestion? Do they have habits? Are they constantly putting things in their mouth? Dark circles under their eyes? Frequent cavities, no matter how good the home care is? Lips that don't stay together when they're at rest? See, none of these alone diagnose anything, but it helps point towards a breathing issue that deserves more attention and possible early intervention. So who should evaluate your child for this? See, this isn't something that one healthcare provider manages alone. Have these conversations with the providers that your child is seeing, and the best outcomes happen when all these providers work together. Depending on what is causing the problem, have these conversations, get an evaluation by a dentist, a pediatric dentist, an ENT, your pediatrician, maybe even a sleep physician, a myofunctional therapist, speech and language pathologist. See, no single specialty has every answer. I've always said it takes a village to treat a child. Airway health is collaborative. There's one thing I want parents to remember. If there's only one thing you're going to take from today's episode, let it be this. Children should be able to breathe comfortably through their nose during the day as well as in their sleep. If they can't, and I don't mean, it's a one-time congestion, we're not going to ignore a child that has all of these symptoms chronically, right? We're not going to ignore it. We're not going to assume that they're going to outgrow it. Don't wait until someone mentions braces or sleep apnea years later. Ask questions. Nobody knows your child better than you do. When in doubt, be the advocate. What's the worst thing that'll happen? They'll say, no, everything's fine. Oh my gosh, isn't that what we want? But what if there is a concern and you were the one that noticed it first and brought it to the attention of their healthcare provider? Because sometimes even the smallest signs today become the opportunities to change your child's future. Thank you so much for spending part of your day with me, whether you were listening in, watching this as a video. If this episode made you think about your own child or a child in your life, if you're a teacher and educator, share it. Share it with the parents in your life. Share it if you're a grandparent. Share it to anybody you know that has a child that could benefit, because these conversations have the power to help families notice what they've never been taught to look for. As always, leave us a review, hit that subscribe button. I will see you next time.